The local innovation scaled through enterprise networks, also known as LISTEN, is a process born from collaboration and vision. Developed with resources from a planning grant by the Bill and Melinda Gates Foundation and implemented by the National Syndemic Diseases Control Council, LISTEN was undertaken in Kiambu and Homa Bay counties in Kenya from 2018 to date.
LISTEN as a program is an abbreviation of Local Innovations Scaled Through Enterprise Network. But LISTEN is a strategy that is focusing on community of practice. That is people who stay in the same area, have common interest, and doing the same, more or less the same thing.
This innovative process utilizes human-centered design to empower communities, drive innovation, and tackle persistent health system challenges head-on.
So basically, for all the CPs, it was because they are either touch points or service delivery points for our target population. We have the Boda Boda Riders. Boda Boda Riders is one of our CPs. We have the Maisha Youth, that is young people and adolescents and young people. We also have male champions, who are men who have been brought together different ages to be able to target men in the communities. We also have Youth Advisory Council for Health, that is YACH, as well as the newest one, that is Teen Mothers CPs, that addresses issues of teen pregnancies, GBV, and other related issues.
We have 4 elements that we really talk about. The first element of LISTEN is engagement with local leadership. So it means when the project came about, we first of all introduced this to county government leadership, where by then the governor was introduced to the project. The local leaders, including some of our MCAs, were introduced to the project, and then we shared with them the goals and the objective of the project. And then the second element of this project is basically working with communities of practice. A community of practice basically is a group of people who share the same vision. It is a group of people who have a similar challenge, and they have that will to solve it together. The third element of LISTEN is leverage on human-centered design approach. And basically, under this, we tend to train the communities so that they understand when we are working with them, the focus is at the end user. So basically, we come to the community. Any solution to the challenges that the community is facing, we design together with the community. Yeah, we listen to them, and together we are able to design a solution for the problem that they are facing. The fourth element of LISTEN is use of data for decision making. Before we even settle on a particular problem, we try to understand the problem and see whether we have enough information to support whether it is really a challenge to the community. And then we use that data to come up with a solution together with the community. And then we work together and gather information as we work, as we try to get a solution for the same challenge within the community. And every time we gather that data, and that is what informs the progress in terms of investment within the community.
With a focus on promoting good health choices, improving service delivery, and accelerating progress towards universal health coverage (UHC), LISTEN stands as a beacon of community-driven change. Join us as we explore the transformative power of LISTEN and its journey towards healthier, more resilient communities in Kenya.
HIV and AIDS is a problem worldwide, and also as a country, Kenya, President Moi in 1998 declared HIV as a national disaster, which means as a national disaster, it's something that all responses, both emergency and also multi-sectoral response, was called upon to help in this epidemic response. And you realize that Homa Bay County is one of the counties which has the greatest burden of HIV and AIDS. From 1998, where we had a prevalence of 27.5, all the way, which was the highest in the country, up to now where we have a prevalence of 15.2%, which is still high. But we have seen a marked change in the prevalence, moving from 27.5 to 15.5. Homa Bay has a majority of a fisherfolk population, which means the highest income generating activity is from the fishing population. So there's need to design a framework for HIV prevention for this a vulnerable population which we call the fisherfolk population.
Generally, Listen has made it easier for us to interact with the people that we serve, our fellow adolescents and young people, in that we get to understand the problems they are facing from their own perspective and not from what we think. And we've also been in a position to actually get the solutions to their problems from them. So thanks to Listen, at times we won't be finding ourselves repeating the same thing again and again. Since we are having the community adopting the program better and with a positive approach and perspective.
The Listen model implementation process unfolds as a strategic journey towards impactful change and sustainable solutions. High-level engagement sets the stage, ensuring buy-in from decision makers and fostering a collaborative approach to health and HIV initiatives. Identification and networking of communities of practice, CEPs become the backbone of the Listen model, creating interconnected networks of stakeholders and professionals. HCD principles drive the process, empowering CEPs to identify priorities, find solutions, and implement accountable action plans. Improved data use at all levels fuels progress, with dashboards and analytics providing insights for CPs and decision makers alike. Through strategic planning, collaboration, and data-driven approaches, the Listen model paves the way for transformative healthcare delivery and community empowerment in health and non-health related issues.
The boda riders now are more enlightened about the causes or the effects of HIV to their lives, to their health, and the family health. There should be first the status of the partner, and from there they take precautions. For example, using condoms. We encourage them to go for testing. By talking to them and bringing in linkage, the Department of Health at the county, when we have meetings, we call them to come and sensitize the boda level riders at their group level or at the ward level or at the sub-county level, so that the professionals in the health field, in the field of health, will come to talk to them and tell them, and they can do what we call testing on the ground. And this is where we now, as a boda group, we ask for outreaches. We've asked for outreaches from NAC office in Homa Bay, where we coordinate with the coordinator over there. And we have an outreach. For example, we had one in Kobodo ward. We had one in Kosewe ward in Diwa. And we were targeting exactly boda riders.
We have linked together with the security team, the OCPD, the OCS, yeah. So we decided to come up with our identification plate number so that we know who is this rider that is working on our jurisdiction. When we did not have this, the identification plate, we had a lot of cases of theft, yeah, snatching of phones, snatching of women's wallets, yeah, raping. We had such issues, so now we don't have such an issue because those people who are not genuine, they are not being registered as a rider. The identification plate number has the information, the QR code has the information of the place that you come from, your ID number, your pick point, your chairman, and also your number, your telephone number.
Kane wago mnangware mar ndega. Wadhiro ndega ga ahinya ka ndega notamwang'wa. To ne okel mashinde moko mag ndega mane wanyalo ole fuel matin. Ka gigo norumo, to apoka boda chopo. Bedo ne wan gi ndega, ne watwenyo pidhe, ne ok wanyal lawo sa, but boda oketowa sani movement maber mwanyalo ringogo, kendo walawo sa, wanyalo yudo sukari moro matin, nyithindo nyalo madho. Kaka ne Listen obiro, gidhi gipuonjwa kaka wanyalo chenjo ngimawa kaka jo boda, gik ma wanyalo loso ka watiyo boda no. Omiyo sani jo boda osechange. Ngimagi mane samoro ne ng'ato nyalo riembo apiko kan kata siling moro 10. Sani nyalo yudo ka ng'ato kano siling moro 20 odiechieng' kogik 1 week, to wanyalo nyiewo ni kata diel moro iketi abila kanyo.
One of these communities of practice is the fisherfolk. Now, the fishing community depend on the lake for their day-to-day activities, for their economic income, and for subsistence.
To ne wan jok mane odak adaka makia gimoro amora no wang'e ni okwaya lupo to watimo ang'o, pesa wachamo cha. To gi sani chako warom gi jogo no owuoyo kodwa mano bilwa financially, masani wang'eyo wan nyaka gi Fisher Folk Sacco makwaya nam to yudo kwa wae gimoro matin.
They also brought us the weather forecast. They brought us some flags. So when you see this color, you know the lake is rough. When you see this color, you know the lake is okay. You can now fish. You can say now life is good for us. We have money and then we have good health.
Key population are this target group that are vulnerable or at high risk of HIV infection. Yeah, so they include the FSW, that is female sex workers, the MSM, that is men who have sex with men, and also we have the PWIDs, people who inject drugs, and also we have transgender persons under the KIPI program.
Men don't seek health issues at the hospital. They just come when it's too late.
As a male champion, we are engaging especially men on triple threat, where we target HIV, AIDS, teenager pregnancy, and sexual gender-based violence.
Nilitoka kwa nyumba ambayo ilikuwa na gender-based violence hiyo. Mama anapigwa. Hata mimi nikakamata hiyo roho ya kupiga bibi. Hii kidonda ilikuja hapa 30 years ago because of gender-based violence. Yeah, that training, I don't fight her. Hata watu wakipigana tunaenda naye for the counseling.
We have reached 15,000 young people in the island, but unfortunately because of the terrain of the island, we could not manage to reach all of them. So we have young people who are in agriculture. We have a farm called RJ Farm. We started this farm due to lack of enough vegetables in that region.
So my name is Dennis White. I'm one of the founders of RJ Farms. The community needed some food, but in order to get them, they had to go to mainland, Mbita. But we found some challenges in producing that food. One of those challenges is the poor irrigation system. People are scared of producing food because they can't irrigate their own farms. It was so tiring. Some people used to go by the lake, wanachota na mitungi, wanamwaga. So tuka install the drip irrigation system. We also use ancient technology. Tulikuwa tunahitaji cooler, but we couldn't afford it. So we decided to try the charcoal cooler. Tukisha harvest food hapa hivi, they are being taken to the charcoal cooler where they can be preserved. They can remain in for 24 hours. It gives us time pia and tuuze hiyo chakula.
Wewe kum jok mokelo lesen to agombo ne gilok ni koro gikelnwa puonjruok groups mawantiere mondo nitiere kech boda oting'o youth to oting'o jomadongo. Koro samoro jomadongo ok nyal chopo kuonde ma wantiere maboyo. Koro ne wagombo ni gikel gige stages ma ginyalo yudo kata jomadongo gipuonjnwagi mondo gimbende giyud change ma youth osayudo.
So my message to every young person out there watching me is that the fight against HIV is each and every person's responsibility. And we really need to ensure that we are protecting ourselves and we are protecting the people around us.
So our mission is basically to sustainably improve the health outcomes. Under LISTEN, we had three main pillars. So the first pillar is the community. To really understand the community and of course the issues that they have and the challenges that they have. Looking at their capability in terms of what strengths do they have and what areas do they need support. Then we bring in the second component of what we are called the human-centered design. The third aspect is about the data, which is very critical. When you have those statistics, do they make sense to a Boda, for example? How can you be able to ensure that the Boda can be able to get data that makes sense? They can be able to get that data, make use of it, make their own informed decision when they're having their meetings weekly, and of course try to be able to see how they can be able even to utilize that to improve their service delivery. So through Listen, which has been kind of a mindset change, has enabled the communities to be able to sit in their meetings using their own resources, and what they do is just layer in HIV. We have the technical team that can be able to provide that data to them and say, hey, based on what was done within this location, we tested this number of boda raised. The number of boda that we tested, 10 of them were positive. We are not doing very well. So what you need to do is let's kind of continue to sensitize our members. So you make data speak to the intervention that you are carrying out.
So we don't disrupt what they do, because in our understanding is that if human beings have a challenge and you don't sort out the immediate challenge, then you try to bring them on another challenge, especially something like HIV that requires behavior change. You find that they're not listening to what you're saying because they are preoccupied with the problem of the day. If they don't have a health insurance, for example, and they're talking about access to services, the first thing they actually put as their solution number one was NHIF. So the first coming together, let's fix the NHIF problem.
Through Listen, I've been able to start a program that is known as Street Business School. Most of the women that we engaged with were talking about economic vulnerability to HIV. So Street Business School is a more of mentorship and coaching of young women as entrepreneurs with the aim of reducing economic vulnerability to HIV. And so far, we've trained 151 women. So recently, we just graduated 91 women whom we've also taken through a 6-month program and given them 6,000 Kenyan shillings as a startup grant to start and sustain their businesses.
Where we are seated is the Youth Friendly Center. And we were able actually to select this space as a hub for the adolescent and young people so that they can address what do they need within that hub. And some of the things that they said were to give them some games within the hub and also some entertaining equipment. So far, the National Epidemic and Diseases Control Council, through the Georgetown University, were able to procure some of the equipment that we are having. We have the chess, we also have the Monopoly, we are also having the Scrabble, we also have guitars here, and we have the pianos. So whenever they come here, they can be able now to play those games. As they are waiting for other people to come, they are engaging themselves in terms of games and such. And we can be able now to say, without blinking of the eye, that we have improved in terms of behavior modification of our young people within these areas.
We use Friendly Center as our place. Like, we didn't have a space to meet young people. So a Youth Friendly Center has been like our office where we meet young people come, we have conversation, we talk. We are also doing a lot of collaboration and partnership with other youth-led organizations. We just have this conversation on sexual gender-based violence, HIV, unwanted pregnancy.
Listen program via the NSDCC has been very impactful. I wish more programs like those zinaweza fikia young people in the community. We have so many resources at the community level. If such organizations work with the governments and come to young people, it can be very impactful.
And that's why we were saying it would be nice if the sponsors could consider rolling out this program to cover the entire nation.